come in.
All right, hi, I'm going to provide some privacy quick. How are you?
Good. How are you?
Good. Hi, I'm Samantha. I'm your nurse today.
Okay.
All right, can I get your name and date of birth?
Miss Bronchi, and I was born 2003.
Okay, great.
And I'm Mom.
Hi, Mom. All right, I was told by your physicians today to talk to you about self-injecting your...
Okay.
It's your methylprednisolone acetate.
Okay.
So it's a big word, but it's also known as solomedrol.
Yeah.
So it's a corticosteroid, so it's supposed to help with your flare-ups that you're having, with the coughing at night.
Okay.
So it's just supposed to help. It's a steroid just to help reduce that inflammatory.
Oh, okay.
You are prescribed 41 milligrams per milliliter a day, which is 1 milliliter of the injection of the vial. So it's not as bad as you think it is. Okay. So are you ready to learn? Do you have any questions about anything?
Yeah. Oh, hold on a second. My boyfriend keeps texting me.
Right. If you would be able to just shut down your phone for just 5 minutes, just your undivided attention.
Okay.
It's pretty important. This is a needle that's going near your skin. So this definitely is something so serious that you want to pay attention to, okay? So with your medication, it comes separately, so you're going to have to add the syringe to the needle itself.
Oh, okay.
Okay. So you're going to take out the syringe from the packaging, and you're going to just screw it onto the needle itself until you can't anymore. Okay. So then it's just all one piece rather than two.
Okay.
Okay. So what you're going to do first is you're going to always hand hygiene, which I already did.
Okay.
So then you're going to apply gloves, and then you're going to clean the vial with a alcohol prep pad. And then you just let that dry. While you're doing that, you can work on your needle. So what you're going to do is you're going to need 1 milliliter of your medication. So you're going to pull back 1 milliliter of air in the syringe. So then you are going to take off the needle, and you're going to put the needle in the center of the vial, and you're going to apply that amount of air into the vial just to pressurize the vial before taking out the medication. Alright, so you're going to turn it upside down, and you're going to take 1 milliliter, so it's going to be up to the black stopper, the second line. You're going to take that amount of medication out to 1 milliliters. Okay, you see that, Mom?
Yes.
Okay, great. So you're going to pull it down. You're going to pull it out. You always want to make sure it is coming from the center of the vial. You're going to use a Z-track method afterwards. So what you're going to do is you're going to cap your needle first, just so you can prep the skin. So it's an intramuscular injection.
Oh.
So it's going to go into your deltoid muscle.
Okay.
You're going to pull back, you're going to clean the skin first in a circular motion. You're going to let it dry for a little. And then you're going to do a Z-track method to basically inject yourself into the muscle, and then once you let go, it absorbs the medication rather than letting it ooze out.
Okay.
Okay? Does that make sense? So what you're going to do is you're going to inject in a 90-degree angle into the muscle. You're going to pull the plunger down, let the muscle out, and you let the skin fall back over. With this type of needle, you pull up and it releases a safety cap, so therefore you can't use the needle again, nor anyone else can prick themselves. But at the moment, we're going to just cap it and put it in a sharps container.
Correct.
All right?
So
Any
no, I don't think so. I think I got
Are you
it.
ready to do it?
Oh, okay.
All right.
I think different.
Yep.
All right, so I'm going to do hand hygiene, and I'm going to wipe my vial down. Throw this away. Then I'm going to take my syringe out, and I'm going to twist the needle on until I can't twist anymore.
Correct.
So, then I'm going to uncap. Leave it where I could get to it easily. Pull back to 1 milliliter.
Correct.
Right.
So you always want to pull back the 1 milliliter amount of air that you would need medication. Yeah.
Okay. And then I'm going to go directly into.
You can always hold the vial to make sure you.
Okay.
There you go.
back to 1 milliliter because that's what I need. And I'm going to flick, make sure there's no air bubbles. Turn it back down, pull out. And I'm going to recap. So I could clean off my arm. Circular motion?
Yes.
And then I'm going to uncap again.
Yep.
Wait till it dries.
Right.
And Z-track method.
The Z-track, so you pull back the skin. Yep.
And just 90-degree angle. Checked. Pull out and then release.
Yep. And then you can always use a gauze pad or a bandage, whatever you want, in case like the bleeding is too much.
Okay.
All right, great. You did
Alright,
awesome. Do you have any
thanks.
questions?
No, okay.
Okay, great. I hope you enjoy your vacation.